referred to the cardiac arrhythmia service because you have an abnormal heart rhythm that would normally require you to take a blood thinner. There are many reasons some patients are unable to tolerate blood thinners and are therefore referred for a Watchman left atrial appendage closure device. This device is placed inside the heart where blood clots typically form to prevent them from leaving the heart and causing a stroke. Once this device is sealed in place, it may be possible to stop taking blood thinners without increasing your risk of stroke. However, it is important to mention this device will not fix or stop your atrial fibrillation. The Watchman device is placed through a catheter or tube through the vein in your leg up into the heart. This is done under general anesthesia, so you will be completely asleep for the procedure. You will also spend one night in the hospital. At the end of the procedure, all of the tubes or catheters will be removed and a stitch or suture may be placed on top of the vein to plug up that hole. This stitch will dissolve over the next several weeks. You cannot see this stitch and it does not need to be removed. If you press very hard over these areas, you may feel a little marble-sized spot there, and this is normal. This will go away over the next several weeks. On the skin itself, you will see a little puncture site as if you had big intravenous lines there. This will go away over the next several days. On top of your skin, a bandage will be placed to keep the area clean and dry. The day after the procedure, the tape and gauze dressing will be removed, and you may shower and wash this area with plain soap and water. Do not scrub directly at this site. Instead, just let the water and soap run gently down your leg. We also do not want you to sit in or submerge this site in water for 1 week to avoid infection. This includes baths, swimming, hot tubs, lakes, oceans, and pools. After you shower, do not put powders, moisturizers, ointments, or lotions on the groin site for a few days. The site may stay open to air without another bandage on top, but you may also cover this if you wish. It is normal for this groin area to be mildly tender or bruised after the procedure. The bruising may get worse and expand down your leg. There may even be some slight swelling. All of this is normal. The area should not be swollen more than the size of a marble and should not be severely painful. These areas should not be red or warm to the touch. If you notice any drainage, if the area becomes painful or hot to the touch, or if you see signs of infection such as fever, you should call our office. Activity-wise, you are restricted from heavy lifting or strenuous exercise, also for 1 week. Heavy lifting is considered more than 10 pounds, and strenuous exercise includes running, cycling, elliptical, rowing, yoga, golf, pickleball, using a lawnmower, etc. Walking is okay, and you may climb stairs slowly. These restrictions are to protect your groin site. And lastly, we say no driving for 2 days, given the repetitive motion of using the pedals and the pressure this puts on your groin. Other restrictions related to the Watchman is to avoid dental work that isn't an emergency for a full 6 months to reduce the risk of infection. If you need emergency dental work within these first 6 months, please call your regular doctor or your heart doctor first. Your doctor may need to give you an antibiotic to take beforehand. You should let your dentist know about the Watchman device at your next appointment. Lastly, your heart sits inside of a sac called the pericardium. This can get inflamed during the procedure. Some patients notice chest discomfort after the procedure, especially when they take a deep breath in or change positions. We call this pericarditis, which is a fancy way to say that sac is inflamed. This is not normal after the procedure, so if you notice this type of chest pain, please call the office immediately. Once you have the Watchman device in place, it will take approximately 6 weeks for the device to seal over. Until this happens, you will be on medications to help thin your blood. This means either a blood thinner or medications to prevent the platelets in your blood from sticking to the device. Your doctor will determine which combination of these medications you will take. 6 weeks after the Watchman device is placed, you will have a special echocardiogram or ultrasound of the heart to check your Watchman device, and you will receive sedation for this. This ultrasound is called a transesophageal echocardiogram, or TEE, and the ultrasound probe is passed through your mouth to your esophagus, or food pipe. This sits behind your heart and enables us to see the backside of the heart where the Watchman device sits and whether it is sealed over. Someone will need to accompany you to that appointment. This appointment will be coordinated by our office, and you will be contacted regarding date and time. Do not stop any of your medications until you are seen in the office. You are still at risk of a stroke while the Watchman device heals. Signs of a stroke include numbness or weakness on one side of your body, drooping on one side of your face, or slurred speech. You should call 911 if you develop any of these symptoms. If you have any questions or develop any bleeding as a result of the blood thinners, please call our office and your doctor will determine whether or not to stop or change your medications. You will have a follow-up visit with your doctor or their advanced practice provider in the office after your heart ultrasound is performed. At that visit, they will determine if you can stop the blood thinner or if any other changes need to be made to your medications. If you are having any bleeding or symptoms from the procedure, please call the office. If you have any general questions, you may call the office or send a message through Patient Gateway. Please note, we do not check Gateway messages overnight or on weekends.